Hey there. As we started writing up this episode, the U.S. government was starting to reopen after the longest shutdown ever. 8 Democratic senators had made a deal.
But this deal has Democrats divided. It does not include an extension for Obamacare subsidies, which is what the party was holding out for.
And people were pissed. Here's a couple examples from our social media feeds.
8 Democrats caved and betrayed the American people tonight.
The Democrats caved. The Democrats caved. What are you? I have tried to calm down so many times to record this video. But
those Democrats did extract one sliver of a concession, a promise from Republican Senate Majority Leader John Thune to schedule a vote on extending the subsidies for early December, which lots of people found unsatisfying. Here's one more from our feed. There's some strong language in this one.
After 40 days of fighting for our subsidies, we got a pinky promise, what a gut punch. The 8 Dems caved and then they fucked our families. And that's the way they all became the bitch-ass bunch. The bitch-ass bunch.
Yeah. News reports pretty much all say that vote to extend subsidies, it's gonna fail. But even if they're wrong, even if some unexpected deal gets made, you can expect nightmares, like logistical nightmares, tech nightmares. Julie Appleby is a reporter with our pals at KFF Health News, and she talked to folks who run the Obamacare exchanges in a bunch of states. And she asked them, hey, if Congress makes a deal, like what happens next? And they were like, well, we'd have to take our websites down to plug in the new numbers.
And that could take maybe up to a week.
Yeah, a week. Julie says that took her by surprise.
I guess I naively assumed that, it'd be pretty easy. Let's just, program these numbers in. It might take a couple hours or whatever. But no, it's not just a simple, let's throw a switch and change all this stuff on.
And there's a ticking clock. If you want an Obamacare plan that starts covering you on January 1st, you have to sign up by December 15th. And again, if there's a vote to do any of this, it's not supposed to happen till December, tick-tock. So look, nobody can predict the future, but if you're looking at Obamacare for 2026, don't count on those extra subsidies being there. Meanwhile, premiums are going up, both for Obamacare plans and for employer-based insurance. So we're going to spend the rest of this episode looking at, okay, now what? It's the worst ever year to choose insurance. What do you do? We're going to hear from a listener who wrote us asking for advice, and we'll look at what next year looks like for ourselves, for me and my colleague Emily Pisacreta. There are folks who have it worse than we do. Millions of people just won't be able to afford insurance at all for next year. But our stories give a sketch, a little sample, and some lessons and tools that I hope will come in handy for anybody asking the same kinds of questions we are. Like a lot of our stories, like, our whole beat, there is no happy ending here. This absolutely sucks. We're talking about choosing the least crappy option here, which, even when all the options are crap, is still worth doing because some options are so much crappier than others. But sorting out which ones, that means learning to read some fine print. So, let's get to it. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter, and I like a challenge. So the job we've chosen here is to take one of the most raging, terrifying, depressing parts of American life and bring you a show that's entertaining, empowering, and useful. Let's pick up where we left off a couple of months ago with this show's senior producer, Emily Pisacreta. Hey, Emily.
Hey, Dan.
So let's recap.
Yeah. So before, I had insurance from another part-time job, but that job ended over the summer.
Yeah. And An Arm and a Leg has always been so tiny. I never thought about budgeting for anybody else's health insurance.
So I had to look for Obamacare. And I ended up getting help from the absolute best person.
Yeah.
Elizabeth Benjamin. She's the vice president of health initiatives at the Community Service Society of New York.
Yeah, she has been one of our go-to sources for years because her fights to protect New Yorkers from medical debt are epic.
And as it happens, she's also a navigator for Obamacare. She helps people choose and sign up. She invited me over to look at my options.
Okay, so ready?
I'm ready.
All right. So
The good news, I qualified for a subsidy. The bad news, that was going to come to a screeching halt in January.
Yeah.
She suggested we meet again in November to look at my 2026 options. So last week we did, just a couple days after those Senate Democrats had folded on the enhanced subsidies.
It's quite clear that the enhanced premium tax credits are going to sunset, right?
Yeah.
Which is really horrible for patients.
Are you surprised, or did you sort of see the writing on the wall?
I find understanding Congress and the federal government and what they're going to do really challenging. I would have thought people would have wanted to do something, but it's hard when people aren't getting SNAP benefits and planes aren't flying. And for me, I would have thought that they would have been able to come up with a compromise, but they didn't. So, I don't know. All right, let me show you your thing.
Do you want to share your screen?
Okay. So here's your account. Here's your eligibility. This is what you have right now. Your tax credit is $385 a month. Your income, if it's unchanged, means you will be eligible for no tax credit next year.
So we kind of knew this was coming. I make a little bit more than 400% of the federal poverty level, which means I don't qualify for that enhanced premium tax credit anymore.
You're being impacted. Like you are going from spending whatever it was, $400 a month to $800 a month.
Actually, it's going from $496 to $867. And all of this is for what's called a silver plan, not platinum, not gold.
You're not talking about Cadillac coverage here. You have a big deductible.
Yeah, so that's $2,500 before I can afford to see a doctor in person, a doctor who's in-network, in an itty-bitty network. So I kind of wondered what I could get if I just leveled up a little bit.
So you want to do the cheapest gold or like a mid-price gold?
Yeah, let's just see what the cheapest golds look like.
So the cheapest is $1,100. So
wow,
that's a lot. That's a $600.
Yeah, so that was out of the question. And we looked at what a slightly cheaper silver plan would be too. But the deductible was a lot higher, and the ER coverage was pitiful.
Just walking into an emergency room in New York City is like $10,000. So you'd be basically paying your whole emergency room visit. Whereas right now, you have real protection. You only have $500.
And anyway, for all of its holes, my current plan, like all of these New York State marketplace plans, does actually have a big advantage over every other health insurance plan I've ever had. $0 copays for my absolute do or die stuff, my insulin and my continuous glucose monitor.
Yeah, this is just one way where you live really matters.
Yeah, and I'm never leaving. I'm like the worst kind of New York chauvinist. But the cost of living here does mean this premium increase is gonna really hurt. I'm gonna need another job.
Yeah, but I want to keep you in this one. And, we're working on a plan there. We're gonna come back to it later.
Mm-hmm.
Meanwhile, you've given us a snapshot of Obamacare. But Obamacare plans are not the only place where costs are going up. According to a survey of 1,700 businesses, the rate hikes on employer plans are the biggest in 15 years. And you know who's on an employer plan? My family. My wife and I both have small little businesses, and we've been able to buy small group coverage for ourselves that way, which means we do get to choose from plans that aren't on the Obamacare exchange. So, here's a little heartwarming scene from my house. Me showing my wife, Devorah, what our health insurance is going to cost next year.
All right.
Make sure we're recording. Let's see. Here we go. All right. So let me just show you what I have been looking at.
All right.
And be aware that it super sucks.
All right.
And here's what I showed her. Our insurance plan is going up by $500 a month in January. So $6,000 a year.
Not allowed to say bad words, right?
You're totally allowed to say. Are you kidding me? Bad words are very appropriate.
Bad words are forming in the thought bubble over my head.
You can say them all you want.
Okay, fuck.
Right, yeah? Absolutely fair. The new total for our plan is terrifying. And for reasons I'm going to get to, that plan still looks like our best option. Meanwhile, we'd heard from a listener. Jess lives in Indiana, and she asked us to just use her first name to protect her family's privacy. And she wrote to ask, Hey, have you ever done a show about whether having health insurance is even worth it? It is a perfectly understandable question. So we talked in early November.
Does it ever make sense to just, if you feel relatively healthy, like if I take what I'm paying for a premium and put it into a bank account, does that make more sense than just giving over this huge percentage of money? It feels like there's not an answer.
In her case, it looked like insurance for her and her husband was going to go up a couple $100 a month for the same crummy, bare bones plan they already have that could still leave them on the hook for like $17,000 in medical bills.
Obviously, I feel really lucky that we don't work through the federal government or any number of folks who are dealing with much more this year than we are.
Yeah.
But then at the end of the day, it's really hard to press the button and sign up for something that you're like, well, I know I'm not going to get great care because the one plan I chose really limits the amount of doctors I can go to.
And she says that limited list of doctors, it's got a lot of turnover.
So we've been through how many doctors in the past 5 years. Then I know that if anything bad does actually happen, I still got to come up with $17,000 to pay those bills on top of everything else. So sometimes I'm just wondering, with a system that doesn't make any sense, where's the line where I just feel like a lot of people are going to be thinking about this year. What, I'm going to keep the money, I'm going to put it in the bank, with people losing their jobs and stuff too. Maybe it's time to just bulk up your savings. I don't know.
Jess and her husband run a small business, and it hasn't been a great year. And next year could be kind of dicey. On the other hand, her dad survived a major bout with cancer earlier this year. And that experience had already been nudging her toward pressing the button, paying the extra for insurance. And then, a little after she wrote me,
I was visiting Dad this fall. So it had been long enough that he actually got the I think it's probably the explanation of benefits or whatever.
Yeah, explanation of benefits. That's the insurance paperwork that shows the total charges for all that cancer treatment and what the insurance company paid.
And he's like, do you want to know how much that cost? It was $1 million.
Oh my God.
I was like, what?
Oh my God.
Okay, I guess I'm getting health insurance again this year.
Jess and her husband can find the extra couple $100 a month, and they will. But it still feels unresolved.
I really love really trying to understand a problem I'm trying to solve and making sure I feel like that's the hard thing with this is that every year I'm have I thought of everything? Have I considered all the parameters? Have I done the right research? And just kind of feeling on your own with it, even though everyone's going through the same thing.
For sure. For sure.
It sucks.
Here's what's coming next. We're going to come back to Emily's story and mine. And there's a possible less sucky option for Emily. It's going to take some doing. And in every case, we're looking closely at the options we do have. Going through all that paperwork is not fun, but the details we found buried there are going to make a huge difference. And we knew where to find them because we've been doing this, looking at the puzzle of shopping for health insurance for a lot of years now. So we'll walk you through some of what we did, and we'll recap some of what we've learned over all this time. That's coming right up. This episode of An Arm and a Leg is produced in partnership with KFF Health News. That's a nonprofit newsroom covering health issues in America. These folks are incredible journalists. Their work wins all kinds of awards every year. We are honored to work with them. Let's go back to my house for starters. As you may recall, our plan for next year is going to cost about $500 more every month. That's about $6,000 for the year. And Devorah and I were processing.
I mean,
it's a lot.
That's a lot of money.
It's a lot of money.
And that's just additional money. We're already hemorrhaging money on health insurance before it goes up $6,000.
Right. We're already paying a lot. And so we're looking at adding $6,000 to that. And
can I have a different timeline?
We'd all like that. Now, there are alternatives. They're not great.
Okay.
Our broker had sent us a couple other plans to look at, and they were a little less. Instead of $2,600 a month, they take it down to about $2,300.
Okay.
But by paying $300 less, we pay more for things like office visits, which we use a fair amount of, to see therapists and stuff like that. I mean, look, you think I could make a show like this without some serious support for my mental health? One reason we are looking at these super expensive plans is our therapists accept them. And the co-pays to see them on these less expensive plans were much higher. Like, it ate up all the savings. I had a whole little spreadsheet. And I was hoping Devore would be like, wow, you are so good at math. But she was looking at those totals for the full year and doing her own math. You know, we've got a kid who'll be applying to college next year, and Devore's been using a tool called the net price calculator. It looks at a bunch of factors, and it gives an estimate of what we'd probably pay after any financial aid. And so Devore was mentally comparing what she'd seen there to what my spreadsheet said we'd be paying for healthcare in the next year.
Do you know that this looks exactly like what the net price calculator says we might pay for college in a year? No, I'm serious.
I know you're
like
serious.
Running the net price calculator with our income, and it's coming out with like almost the exact number you're saying we could pay on healthcare.
Yes, that's right. And this is
insane.
And this, right. The big number to look at next is deductible, and that's where things get very different. Yeah, especially because all of these plans, the cheaper ones and our current one, they all had a feature I'd never noticed before. Family deductibles. It's like kind of a safety valve where if one person's expenses pass a certain point, insurance kicks in for the whole family. And on these quote-unquote cheaper plans, those family deductibles were like $5,000 or even $10,000 more. I mean, I hope we don't end up in that kind of territory. The deductibles on our current plan are already in the thousands of dollars. But if we ever got there, I would sure want to stop the bleeding $5,000 sooner.
I kind of am leaning toward
keeping what we have, right? Yeah, it's weird because I'm like,
but
wow.
That's $6,000 more a year. Okay, I'm going to go take some deep breaths now.
Yeah.
I don't like it.
No, me either. Sorry. Thank you for joining me with this. I'm sorry. Super sucks. It does. And $6,000, that's a lot of money for us. But it turns out those alternative plans don't save us any money, and they leave us potentially on the hook for thousands and thousands of dollars more. So I'm taking this as a win. And it's the lesson. If there's any way to look beyond that monthly premium, you got to do it. And you got to read the fine print. If you got ongoing healthcare stuff or stuff you're going to do next year, like, I don't know, maybe you want to have a kid, price that out for any plan you're considering. And learn the stupid vocabulary, deductible, out-of-pocket max. This time around, I actually learned a new one, family deductible. And then we get back to Emily's case, which actually has a happier side to it, especially after we read some fine print. Emily, we left you with Elizabeth Benjamin, and she had a couple of options for you.
Yeah. So I could either re-enroll in what I have now for $867 a month, or get a plan with a slightly cheaper premium with even crummier coverage. No matter what, I'm looking at paying a way bigger percentage of my income on health insurance.
Yeah, because you would lose this subsidy you have now. But my guy Kurt, my insurance broker...
Kurt.
Yeah, he says there might be another way. If I can bring you on at 30 hours a week versus you're now at 20 hours, then Blue Cross of Illinois would consider you a full-time employee eligible for benefits with an arm and a leg. And, you know, I'm working on it.
I know you are.
Yeah, so toward that end, Kurt has sent me a couple of plans that you could enroll in through an arm and a leg. And like, even if you had to pay the whole premium, they are less than these New York plans. One's like $600, the other's like $690. But the question is, does that really save you money? Because it depends on what they cover, right? Like, I dug up the spreadsheet Kurt had sent me, and, you know, we looked at it together on Zoom last week. I'll look at it together. I'll put it in the chat.
Okay.
So the first numbers, let's just look at
Wait, I gotta put Zoom on 200% here.
Yeah, for sure.
Because they're little. Okay.
So this number really pops out at me. What is the overall deductible? It seems to say $850 deductible. Sounds pretty good. It sounds a little like, is that a typo?
Okay, lower premium, lower deductible. What about my copays? Remember, my New York State Marketplace options have $0 copays for insulin and diabetes supplies.
So this would be one where we would have to do a little more digging to figure out what your out-of-pocket would be.
Yeah.
Let me see what I can find out.
Yeah. I mean, the advice that we were giving people, contact your HR department. It's like, Dan, are you the HR department?
I am. So I'm like, yeah, let's do this. This is going to take a second.
Yeah.
Honestly, it took forever. We spent another 20 minutes on that call trying to get information from my Blue Cross website and then from Google. Ended up sending us to Facebook group discussions and Reddit threads. Emily, you took some time on your own. Okay, a lot of time. And so you called your insurance and your pharmacy and I forget who else. And ultimately, with your incredible Google skills, you found the document that we needed. It's the 2026 formulary for Illinois Blue Cross plans.
Yes, the formulary. That's an insurance company's list of all the drugs they cover and what you'd pay for each one. If you're a First Aid Kit newsletter subscriber, you know, we just wrote about them last week. Okay, so we were looking on this formulary for my continuous glucose monitor supplies. And at first it looked like they were going to be kind of expensive, like $60 a month. But then we saw these little letters off to the side. One was CW, which seemed to stand for cost waived. We hit Control F.
Okay, so that's here. It says, cost waived, CW, medicines marked with a CW in the coverage requirements and limits column are mandated in the state of Illinois to have $0 member cost share.
Hey.
Yeah, right. Yeah.
Okay, so next we looked up my insulins. And I do have a copay there, $85 a month, which unfortunately is pretty normal. And so all in all, this plan was still looking like a winner because of that lower deductible. And then after we did one more round of due diligence, we figured out it was even better than we initially thought.
Yeah, we downloaded another set of paperwork. Every plan has a document called the Summary of Benefits and Coverage. So we grabbed those. And with the New York plans, those documents confirmed you would have to pay out that whole deductible before seeing a doctor. But then we looked at that same document for this Illinois plan, and we found this. If you visit a healthcare provider's office, primary care to treat an injury or illness, deductible does not apply.
Hell yeah.
Whew. All right. That seems like a good deal.
Yeah.
All right, cool. Exactly. Well, this is excellent. Okay, so I think what we've found through our sleuthing, your sleuthing, is this is a better deal. And it's all in the fine print. Right?
It is. Yeah.
I mean, now all you got to do is raise money to bring you on for the extra hours. But we've done the hard part.
Yeah, exactly. We've deciphered insurance lingo.
Oh my God.
And now we just have to pass a hat around. So.
Let's do it. All right, so we have modeled some stuff for you here. If there's medical things you know you're going to need, look beyond the monthly premium. Look at that summary of benefits and coverage. Look for the drug formulary. Read the fine print. Use Control F. Make calls if you have to. And we have a ton of resources to help you keep all of that stuff straight. Because we've covered this stuff before in depth in our First Aid Kit newsletter and on the podcast. And we've collected the most important, most useful stuff, and we've organized it into a starter pack on our website. You'll find a link wherever you're listening to this. And look, there's people for whom none of this can get you to something workable. The spikes in health insurance premiums and the lower subsidies, they mean a lot of people are just stuck. The folks at NPR talked with a woman last week who's in the middle of cancer treatment. Her health insurance is scheduled to jump from $300 some a month to like $1,200, which she absolutely cannot afford. And there are going to be people looking to take advantage of this whole mess. People pitching junk insurance plans and other bargains that don't actually cover enough. And there will be a lot of people facing bills they just cannot pay. Medical debt and aggressive debt collections, all of that is going to hit even more people. Which, honestly, that's why it's so important for us to keep doing this work together. So many people are going to need so much in the coming years. Everything we can learn about fighting unfair bills, applying for financial assistance, avoiding ripoffs, and helping each other, we have got to keep spreading it around. And to do all that, we need your support. For example, yes, I want Emily to have more hours so she can have insurance, but I need more of her time because we got so much work to do. So yeah, we need your help. And this is the absolute best time to help us. Through the end of the year, the News Match campaign from the Institute for Nonprofit News is matching donations of up to $1,000. And if you're catching this in November, well, through the end of this month, because of a special matching fund from the Jonathan Logan Family Foundation, those donations are double matched. You give us $100, and in November, it gets turned into $300. And lots of you have been taking advantage of this opportunity in the last few weeks. It's amazing. You're going to hear a few people's names at the very end of the credits. And some of you have been adding notes with your donations. Kimberly from Texas wrote, "Thank you for all your hard work. I feel surrounded by support knowing you, your tiny team, and all your listeners are out there caring so much." Kimberly, thank you so much. Okay, the place to go is armandalegshow.com/support. armandalegshow.com/support. We're going to have a link wherever you're listening. Everything you give gets matched. Let's do this now. Thank you so much. armandalegshow.com/support. We'll be back with another episode soon. Till then, take care of yourself. This episode of An Arm and a Leg was produced by Emily Pisacreta and me, Dan Weissman, with help from Claire Davenport, and edited by Ellen Weiss. Adam Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Claire is our engagement producer. Sarah Balma is our operations manager. B. Bosco is our consulting director of operations. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. An Arm and a Leg is distributed by KUOW, Seattle's NPR news station. Thank you to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. And finally, thank you to everybody who supports this show financially. You can, of course, join in anytime at armandalegshow.com/support. And in fact, here are the names of a few people who have pitched in for this year's Newsmatch campaign so far. Thanks this time to Ann Bernstein, James Buckley, Sue Marie Casagrande, Janet Cochran, Jennifer Daniels, Kent Doherty, Pamela Todd, Britt Ferris, Deb Furjack, Michelle Foran, Cindy Gatton, Michael Grubbs, James Halpern, Vivian Ho, Marv Hoffman and Rosellen Brown, Anna Jacob, Diane Jacoby, Ken Yonda, Juanita Johnson, William Johnson, Jessica Cagle, Brackets Kaplan, Karen Kolba, Alex Levy, James Lemons, Aviva Levavi, Sally Lewis, Christy Loescher, Emma Maas, Ann Maggio, Marcia Mantell, L.J. Martin, Heather Matthews, Tom McDougall, Tamara Milton, Ed Oburn, Shiraj Panjwani, Sophie Peterson, Sarah Reed, Gwen Rivero, E.J. Rovella, Catherine Schilling, Jonathan Singer, Susan Solar, Diane Solomon, Print and Marketing Solutions, Patty Storms, Jack Strahan, Eddie Torres, Ron Turker, Aaron Van Gessel, Jacob Wagner, Lee Watson, Sarah Weber, and Michelle Zubricki. Thank you so much.